I don't know if a lot of people know this, but last week was actually the worst ever for COVID cases around the world. Record number of cases. It might not seem like that since, hey, I'm vaccinated, we're all getting vaccinated here in the US, but that's not how it's going internationally. And some countries in particular are doing really bad. India just broke a record 234,000 new coronavirus cases. Now, that's a narrow record because as you can see in this chart, we basically got to that too here in the US, but they're not going down now. When that chart gets updated in a day or two, it's going to be even higher. 1.6 million new coronavirus cases in just a week in India, over 1,300 deaths. And you can see, by the way, the chart of the deaths here, if we can switch to this one. You can see that India is shooting up. Now, the US had a couple of bad spikes. Brazil has been lingering at really high number of deaths, but India is going up. And the thing that's really scary about India, and we'll see this sort of play out in some of the evidence we're gonna provide, is that it is incredibly likely that these numbers are not actually reflective of the true numbers in this country. Thanks to how big it is, how spread out it is, the incompetence of the Modi government in dealing with the pandemic, these numbers are horrific, but they're probably only a hint at how bad things actually are. So we'll get to that information, but Bridget, this is sort of a demonstration of what is likely to continue in India and other countries if the US doesn't help by providing vaccines.
Absolutely, it is heartbreaking. And I think, it goes really back to what you were saying earlier. America, we call ourselves the greatest country in the world. We talk about how we're this global leader. This is a global pandemic. And so if we truly are a global leader, this is the time for us to demonstrate that by actually leading. And this is like, the pandemic doesn't care about these borders, right? Like it is a global issue. And I wanna see the United States act as a global leader that we purport to be so often.
Exactly, yeah, and we have that opportunity. So let's get into the evidence now that it might actually be worse than it looks. So as we said, almost 1.6 million cases in just a week, bringing total cases to more than 15 million in just that country. In the space of just 12 days, the COVID positivity rate doubled to 17%, while in Delhi it hit 30%. Hospitals across the country have filled to capacity, but this time it's predominantly the young taking up the beds. In Delhi, 65% of cases are under 40 years old. Because remember, you don't have to be elderly to get this. You might have heard some propaganda from the Trump administration or the right or Scott Atlas or something, but no, young people can and are getting it. So here's the thing about your positivity rate shooting up to 17% or 30% in a city like Delhi. It is changing so rapidly that unless you have an amazing testing capacity, it's almost certainly not reflective of how much COVID is actually out there. They are testing who they can, but they're short on lots of supplies, as we'll get to. And so it's likely that it's even worse in some of these cities. I mean, 30%, that's like New York during the spikes. That's like the worst hit US cities. And we're seeing it now in places where their hospitals do not necessarily have the supplies to actually save the people who are getting sick. That was the sort of saving graces that we had in the US. We eventually got the ventilators, we had experimental treatments and things like that. But that's probably not going to be the case in a lot of these areas. At least that's what the early evidence seems to be indicating, Bridget.
Yeah, it doesn't seem like it might not be. It seems like it might not be the case in some of these places. And yeah, I keep going back to this. I think that we need to help where we can. We are no longer in a place where, it's like New York City, the worst numbers, open the newspaper and it's, deaths on deaths on deaths. And I think that it is really up to us to make sure that other countries have what they need, whether it's the vaccine, whether it's supplies. I do believe that this is a real opportunity for us to act as a global leader. And when I hear about how bad things are in India and Brazil and other places, that's all I think is, we should be helping where we can.
Yeah, and as we always stress, if none of what we've said about why this should happen was convincing to you, just understand that right now in India, they are getting decimated by traditional COVID and COVID variants. And in a population that large with COVID running rampant through so many areas, they are almost certainly going to give rise to other variants on COVID. And if we're lucky, fingers crossed, the vaccines that we have will continue to protect against them. But if you wanted to create a COVID that could break through our vaccine shield, I can't think of a better way to do it than to allow a place like India to just run rampant with COVID. So If none of the other things convinced you, pragmatically, economically, well, how about this? Like, just in terms of protecting yourself, in terms of public health, it seems like a good idea to deal with this. For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.